If you're a medical student, a NEET PG aspirant, or a surgeon aspiring to pursue super specialty, especially in plastic surgery, then this video is for you. Hi, I'm Dr. Chisel Bhatia. I'm a consultant plastic surgeon currently practicing in Dehradun. And in this video, I'm going to cover how I become a plastic surgeon, how you can become a plastic surgeon, what actually plastic surgery is, and what are the various subspecialties in plastic surgery, what are the job prospects, what are the private practice options after you become a plastic surgeon, how is the earning of a plastic surgeon compared to other branches, how is the work-life balance, how is the work satisfaction, what is the future of plastic surgery, and a lot more. And then we'll conclude whether plastic surgery is the right branch for you or not. So when I joined MBBS, I had no idea what plastic surgery is. I did not imagine in my dreams that I will become a plastic surgeon. I did my MBBS, I did my internship. During internship, I was pretty sure, because I did internship properly in all the branches, I was pretty sure that I want to become a surgeon. My first priority was orthopedics, second was general surgery. I was fixed on these two branches. I gave my NEET PG. According to my rank, I had an option to do either orthopedics from a peripheral college or take DNB in ortho or do MS in general surgery from a good institute. I chose the quality of institute over the two branches I was confused in, because I always believe in the quality of education has to be good to succeed in life. So I did my MS in general surgery from Rohtak. After that, I did my senior residency at Chandigarh. I'm also someone who believes that senior residencies are important. You must do it before you move on to the next stage. Then during the residency, I realized that I need to study further. I was confused which super specialty should I pursue, whether GI surgery, plastic surgery, CTBS, all the branches. I met a few plastic surgeons. I read 2 plastic surgery review books completely, got to know about the subject completely. Only then I decided that yes, I can become a good plastic surgeon. And then I appeared for NEET super specialty for plastic surgery. At that time, we had to choose our subject prior to appearing for the exam. Nowadays, it's different. And I got a good rank. I studied plastic surgery at one of the topmost institutes in India, and I think I became a decent plastic surgeon. And it's been 2 years now. I'm in practice and I'm having a good time. I'm enjoying my work and I love plastic surgery absolutely. So if you want to become a plastic surgeon today, let's discuss the pathways you can take. If you are MBBS, you can directly take a 6 years course. Some institutes offer 6 years MCH, some institutes offer 6 years DNB. You can decide accordingly and you can directly get into plastic surgery. Take this only if you are 100% sure to become a plastic surgeon, which usually after MBBS, you're not. You need some time to figure out what you want to become in life. So I don't really suggest you take this option. The other option is you do MS in general surgery, then appear for NEET super specialty, take plastic surgery. Or if you also become an ENT surgeon or an orthopedic surgeon, you can become a plastic surgeon from some of the national level institutes which are under INI. General surgeons will make the best plastic surgeon, I believe so. ENT surgeons will make good facial plastic surgeons. They may not be able to handle the other aspects of it, like the limbs, hands, breast, abdomen, all those things, because ENT training is kind of limited to the head and neck. If you're an orthopedic surgeon and you take plastic surgery, you can use that training to improve your orthopedic practice, but I don't think you can completely leave orthopedics and take plastic surgery. That is not a good combination in my opinion. Comments are always welcome. So the best way is to take general surgery and then plastic surgery, or direct plastic surgery if you are 100% sure. So before you decide to become a plastic surgeon, you must have a very good idea what actually plastic surgery is. See, as MBBS students, we only see skin graftings, flaps, cleft lip, cleft palate, and burns. But plastic surgery is so much more than that. You might be someone who wants to become a plastic surgeon to just do facial cosmetics, rhinoplasties, facelifts, abdomen surgeries, breast surgeries. You might be someone who could be fascinated by hand surgery, trauma surgery, reconstructive surgery. You could be someone liking cancer reconstruction. You could be fascinated by how life-changing a burn surgery could be, or what an impact cleft and craniofacial surgery can have. There are so many subspecialties in plastic surgery that you cannot have an idea about what actually plastic surgery is unless you go through it completely. After MBBS, I was totally clueless about what plastic surgery is. After general surgery, I had some idea. And after plastic surgery, I know that I had no idea about what plastic surgery is. It is a Pandora's box of creativity, skills, imagination. So much advancements have happened in plastic surgery that it is difficult for anyone who is not a plastic surgeon to understand what plastic surgery is. Majority of the plastic surgeons these days do not practice the whole spectrum of plastic surgery. They take a subspecialty like hand surgery, aesthetic surgery, burn surgery, cancer reconstruction, and they just devote their whole life doing just that branch, because there are so many things to do in each subspecialty in plastic surgery as well. I'm not scaring you. The thing is, in metro cities, because there are a large number of plastic surgeons, people have started to subspecialize in a particular field to make their name. In second tier cities like in Dehradun, where I am working, you can practice a large spectrum of it. I'm doing cleft also, I'm doing aesthetic surgery also, I'm doing reconstructive surgery also, I'm doing burn surgery also, I'm doing cancer reconstruction also, a lot of things, microsurgery as well. So depends on where you are working, and the branch is huge. Make sure you have a very good idea. You meet a lot of plastic surgeons. Only then you decide whether plastic surgery is for you or not. Do not go by reels. What you see on the reels is not exactly what happens in reality. It is not just cosmetic. It is not just burns. It is not just skin grafting. There are 6 volumes of Nelligan's plastic surgery lying on my shelf right now, and I don't know when I'll be able to finish or learn from the sea of knowledge that we have here. So yeah, take some time before you decide to get into plastic surgery. So what are the job options once you become a plastic surgeon? First, you join a medical college, give interviews, appear for the seats and vacancies. You will have to fight reservation. The problem is there are no reserved plastic surgeons because there is no reservation in super specialty, but they want reserved candidates at faculty posts in government colleges. I don't know how that works. All those seats are lying vacant. There will be few general seats for which all of you will be competing as plastic surgeons. If you get selected, have a good life, work, teach, study, focus into academics, do research, good life, happy life, have fun. But I have seen that somehow in such government medical colleges, you become complacent. You don't work as hard because you don't need to work as hard. So it all gets into your lifestyle as well. Then you can join a private medical college. They will give you a better salary compared to government medical colleges and almost similar work environment, just private. So that risk associating with a private medical college. Or you can join a multi-speciality or a corporate hospital. That is what I have done currently for the last 2 years because that was the most appropriate option for me. You can watch my other videos how all this has happened. Corporate hospitals and multi-speciality hospitals will pay you well. You can have full-time post or a visiting consultant post, that is up to you, and you can earn as much as you work all day, earn a lot of money, totally your wish. Then you can start your own practice if you have some backing, financial backing, or if you're a second generation doctor, if your parent has a clinic already, that is the most likely option that you're going to take, and you should take it if you have an option for it. If you have some good money with you which you can invest into your clinic, buy machines, set up a beautiful aesthetic center, perfect way to start your practice in plastic surgery. Depends if you have the resources or not. And you can not do any of it and just be a freelancer in the city. If you have good contacts with various hospitals around, you can be a freelancer. Wherever the patient comes, you go and operate and handle those patients. Attach with 2-3 hospitals at a time, be a freelancer in plastic surgery and rule the city. A lot of people are doing that as well. But yes, overall, because the number of patients are lesser in plastic surgery, the work is quite unique and different. We don't treat diseases, we treat problems, which surgical problems and different kind of problems. So yeah, the patients don't directly come to us. So you may not be able to compete with other surgical super specialties in terms of earnings. But once you make your name, it takes around 5 years after MCH, I can say, then you can earn as much as you like. Then you are the one who quotes your amount because you're a famous surgeon. That's how it works in most of the cities. So it all balances out. Don't worry that you don't earn as much as a urologist immediately after MCH. After 5 years, after 10 years, it's all the same for everyone. But yes, if you want to start it in a metro city, it is going to be difficult in plastic surgery because it is saturated. There are a lot of big names in metro cities. You will need to work under someone for the first couple of years, gain some experience under them, and then build contacts, and then find a job for yourself and start earning for yourself where you can earn as much as you work. In the initial couple of years, you will get some minimal salary, almost like a senior resident in metro cities. That's a problem. In second tier cities, in third tier cities, that's not the issue. You can start earning well if you move to a smaller city. And if you are in your private practice, if your aesthetic clinic is doing well, the sky is the limit. There's no stopping you then. You can earn as much as you want. You can become billionaires. But yes, you will have to work hard for it. Majority of the successful aesthetic surgeons who are living such a life right now have done extreme hard work and built their name over a few decades. You must be wondering, is there saturation of jobs in plastic surgery? Not at all. Every hospital needs a plastic surgeon. Every institute needs a plastic surgeon. So many hospitals are coming up. So many institutions are coming up. Plastic surgeons will never be out of job. See, orthopedics, ENT, general surgeons, oncosurgeons, everybody needs plastic surgeons. The more number of these surgeons, the more requirement of plastic surgeons. Don't worry about difficulty in getting a job. And if you are going into cosmetic surgery practice, you don't need a job. You work for yourself. See, you must understand plastic surgery is a principle, and all surgical branches are going to need an expert in those principles. So don't worry about jobs. Just decide what kind of pathway you want to take. Also, if you are going into aesthetic practice, it is better to start early and build a brand for yourself with time, because that's important in aesthetic surgery. If you are not someone who is going to take that path, just take help from whatever institute can provide you the resources. The work-life balance in plastic surgery is pretty good actually. Depends on what kind of work you do. If you take reconstructive surgery solely as your style of work, you may not feel that way. You will have a busy life. You will do all the long surgeries. You will monitor the flaps at night. You will be worried about your patient for 5 days. So yeah, if you do reconstruction, you may not have a chill life, and after coming back home as well, you will be thinking about your patients. If you're into cosmetics and if you don't have complications, you have the best life in the world, but only if you don't get complications. Plastic surgeons usually work 9 to 5. They don't have any major emergencies. Yes, hand surgery is trauma. Reconstruction, you sometimes need to go at night as well. Some vascular injuries, finger replants, all these surgeries need your immediate attention. So if you're handling those reconstructive surgeries, you will have to be alert at night as well. Other aspects of plastic surgery are totally chill. You don't need to worry at night and enjoy your personal life after 5 p.m. Work satisfaction, I would say, is topmost in plastic surgery. We can beat all other branches in terms of work satisfaction because our results are immediately visible. They are so good to look at. Whether you do hand surgery, whether you do facial cosmetics, whether you do reconstructive surgeries, cancer reconstruction, breast, abdomen, limb trauma reconstruction, whatever you do, you are going to enjoy every bit of it. Our work is like art. You plan each case differently. You use your imagination to the maximum. You draw. Looking at your results give you so much satisfaction. That is something I think is enough to take plastic surgery, because it gives you immense work satisfaction. You can forget about everything else and just opt for plastic surgery for the amount of satisfaction that we get after each surgery. What is the future of plastic surgery in India? I think it is one of the most rapidly growing specialties currently. When I was thinking about whether I should get into plastic surgery, everybody counseled me against it. My teachers said, don't take it, there are no jobs, don't take it, it is a dead branch. Now things are completely opposite. I don't know if in medical colleges people are still saying plastic surgery is a dead branch, but now that I have become a plastic surgeon, I have realized that people don't know about plastic surgery. Only plastic surgeons know about plastic surgery. That is why there are so many awareness campaigns going on these days. So please don't listen to anyone apart from plastic surgeons to get an idea about what it is. And it is growing rapidly. Cosmetic surgery in India is booming like anything. In the next 10 years, we might actually be the capital in the world for doing number of cosmetic surgeries. Now, advanced reconstruction is happening. Free flaps, super microsurgery, lymphedema surgery, face transplants, hand transplants. All these are starting to happen in India as well. There are dedicated departments of plastic surgery in medical colleges and corporate hospitals. Everywhere people are focusing on plastic surgery. So our future is bright. The branch is growing rapidly. There's no stopping plastic surgery. Trust me. But yes, with these advances, you need to study a little more as well. So now you might need to do some fellowships after MCH. You might need to train a little more after MCH because of these recent advances. I did a lot of training even during my MCH as well. I went to a couple of cities in India where I learned cosmetic surgery, hand surgery. I went to Ganga and all those places. Even now, I think once I am a little settled in my work, I will be going for some fellowship in a couple of years, maybe a month of fellowship or 2 weeks of fellowship to learn some more skills, because things are advancing at a very rapid phase. So for conclusion, I would say if you want to become a plastic surgeon, don't let go of that thought. Become a plastic surgeon. But make sure what you're getting into before you get into it. If you are MBBS, be very careful before you take plastic surgery. You should have a passion for it. You must understand the subject. You must be 100% sure. Only then you take the 6 years course. If you're a general surgeon, meet a few plastic surgeons, read some plastic surgery books, try to work in the plastic surgery department for a couple of months to exactly know how the lifestyle is. Then take the plunge into plastic surgery and you're going to love it. If you're an ENT surgeon, you will be an amazing facial plastic surgeon for sure. because you are already well versed with the anatomy of this region. If you're an orthopedic surgeon, want to accumulate plastic surgery practices to improve your results and do some limb surgeries, hand surgeries, perfect option. But if you want to completely move to plastics after orthopedics, I don't understand the concept of it. I think you should focus on orthopedics and improve on your orthopedic skills rather than giving it all up and going to plastic surgery. I think I've covered most of the aspects of plastic surgery. If you have any questions, please feel free to write it in the comments. I'm early in my practice. I'm also exploring this branch and I'm loving it currently. Absolutely. I'm enjoying each and every day of my life. You can start following me on social media if you wish and see my posts to see the amount of happiness these surgeries give me all day, all night. That's all for this video. My name is Chisel.